A heart attack, also known as a myocardial infarction, is one of the leading causes of death worldwide. What many people don't know is that the body often gives warning signs days, weeks, or even months before the event. Identifying these symptoms can be crucial to preventing a fatal heart attack. And for those living with diabetes, extra caution is needed. Diabetes is a condition that can significantly increase the risk of heart disease, including heart attacks. Today, you'll discover 7 symptoms that your body may show before a heart attack and how these signs can be even more critical for those with diabetes. Before we get started, I'd like to ask you to give this video a like and subscribe to the channel. It really helps us continue bringing you important information. Sign number 1. Chest discomfort. Chest discomfort is one of the most concerning signals the body can send, especially when it comes to a potential heart attack. In fact, it is the most common and often the most critical symptom. This type of discomfort is not just a fleeting pain or a quick sensation that goes away. It's something that can last several minutes and, in some cases, can become increasingly intense, requiring immediate attention. Many people describe this sensation in different ways, which can make it difficult to recognize the seriousness of the situation. It might start as a slight pressure, something you might not take seriously at first, but over time, it turns into a tightening sensation that seems endless. Imagine an invisible hand pressing firmly on your chest. That's the feeling many people report. Others describe it as an enormous, almost crushing weight that seems to make breathing difficult. And there are those who feel an intense burning sensation, similar to severe heartburn, but which might actually be a sign that the heart is in danger. What makes this symptom even more alarming is that it can appear unexpectedly and catch you off guard. Often, people try to ignore it, attributing it to less serious causes, such as stress or indigestion. But this is an extremely dangerous attitude. Ignoring chest discomfort can mean ignoring a clear warning that a heart attack is about to happen. And for those with diabetes, the situation can be even more critical, as this condition significantly increases the risk of heart diseases, including heart attacks. If you or someone close to you starts feeling this type of discomfort, don't wait to see if it passes. Every second counts. Seeking medical help immediately can be the difference between life and death. Recognizing the signs and acting quickly is essential to avoid a fatal heart attack and its serious consequences. Sign number 2. Cold and clammy sweat. Cold and clammy sweat is one of those warning signs that often go unnoticed, but it can indicate that something very serious is happening in the body. When a person's skin becomes cold and damp to the touch, it can be a sign that the body is under extreme stress and possibly going into shock. This type of sweat is different from the sweat we experience after exercise or on a hot day. It appears suddenly, without any apparent reason, and is usually accompanied by an intense feeling of discomfort that can be hard to ignore. Often, the person may also look visibly pale, which is a sign that the body is not receiving enough blood, potentially indicating that the heart is struggling to pump blood effectively. This symptom is particularly concerning because it suggests that the body is fighting to maintain its vital functions. When blood flow significantly decreases, the body goes into defense mode, sending blood to the most critical organs, like the heart and brain. As a result, the skin becomes cold and damp, a physiological response to the fact that other areas of the body are receiving less blood. Additionally, cold sweat may be accompanied by other warning signs such as dizziness, nausea, or a general feeling of weakness. It's essential to recognize that this symptom should not be ignored or downplayed, especially if it comes along with other classic signs of heart problems like chest pain or shortness of breath. If you start experiencing cold sweat for no apparent reason, it's crucial to seek medical help immediately. Cold sweat could be one of the first signs of an impending heart attack or another medical emergency, and acting quickly can literally save lives. Do not underestimate this symptom. It could be your body's way of warning you that something very serious is happening, and immediate medical intervention is vital to avoid severe complications. Sign number 3. Shortness of breath. Shortness of breath is one of the most concerning symptoms when it comes to heart problems. Often, it can appear suddenly and, what's even more alarming, it can occur with or without chest discomfort. Difficulty in breathing should be seen as a warning sign, as it indicates that the heart is not able to pump blood efficiently to the rest of the body. When the heart is not functioning properly, blood can start to accumulate in the lungs, causing fluid buildup and leading to the sensation of shortness of breath. This symptom can occur during physical activity, but it can also happen at rest, which is even more serious. The feeling of not being able to fully fill the lungs with air, or being out of breath without exertion, is a sign that the body is struggling to get the oxygen it needs. Additionally, shortness of breath may be accompanied by other signs such as extreme fatigue, dizziness, or a feeling of impending fainting. Many people describe the sensation as suffocating, as if they are breathing through a straw. It is important to remember that shortness of breath, especially when unexpected, should not be ignored. It can be one of the first signs that the heart is in crisis and that a heart attack is near. Seeking immediate medical attention when you notice this symptom is crucial, as quick intervention can be the difference between life and death. Pay attention to your body, and don't hesitate to seek help if you begin to feel short of breath. Sign number 4. Discomfort in other areas of the body. Discomfort in other areas of the body is a symptom that often goes unnoticed, but it can be one of the most revealing signs of an impending heart problem, such as a heart attack. When the heart is under stress, the pain or discomfort is not limited to the chest. It can spread to other parts of the body, becoming an important warning that should not be ignored. This pain can radiate to one or both arms, often starting in the chest and moving to the upper extremities. Some people report a feeling of heaviness or numbness in the arms, especially the left one, but the right arm can also be affected. Additionally, the pain can extend to the back, which is common and may be mistaken for muscle or spine issues. Discomfort can also reach the neck, jaw, or even the stomach. Jaw or neck pain can be particularly misleading, leading a person to think they are facing a dental or muscular issue. Stomach pain can be confused with indigestion or a gastrointestinal problem, but it is essential to recognize that these symptoms could be signs that the heart is in trouble. The important thing to understand is that these signs do not appear in isolation. If you feel pain or discomfort in other parts of the body, especially in combination with other symptoms like shortness of breath, cold sweats, or chest pain, it is crucial to seek medical help immediately. These signs could be your body's warning that a heart attack is imminent, and a quick response can make all the difference. Do not underestimate these symptoms and always pay attention to what your body is trying to tell you. Sign number 5. Nausea and vomiting. Nausea and vomiting are symptoms that we often don't directly associate with heart problems, but they can be indicative of a heart attack. During a heart attack, the vagus nerve, which is responsible for regulating involuntary body functions such as heart rate and digestion, can be abnormally stimulated. This can result in nausea and vomiting, symptoms that are often mistaken for gastrointestinal issues or indigestion. What makes these symptoms particularly concerning is that, in a heart attack scenario, the body is trying to cope with a critical event, and this response may be a reflection of the extreme stress the heart is under. While nausea and vomiting may seem harmless in other situations, when they occur alongside other signs such as chest pain or discomfort in other parts of the body, they can be a clear signal that something much more serious is happening. Sign number 6. Dizziness. Dizziness may seem harmless at first glance, but in some cases, it can be a sign of an underlying heart problem. Feeling dizzy or like you might faint, especially when standing up or after physical exertion, is something that should not be ignored, particularly among women. This symptom can occur when the heart struggles to pump blood efficiently to the brain and other parts of the body. When blood flow is insufficient, the body responds with a feeling of dizziness, which may be accompanied by blurred vision or a sense of weakness. This phenomenon can be particularly concerning if it occurs suddenly and without a clear explanation, such as in a hot environment or after a rapid change in position. Paying attention to this symptom and seeking medical help when dizziness becomes frequent or intense is crucial. Ignoring this sensation can be dangerous, as dizziness can be one of the early signs of a more serious cardiovascular issue, such as a heart attack. If you start feeling dizzy, especially when standing up or after physical exertion, it's important not to downplay the symptom and to seek medical evaluation to ensure your heart is healthy. Sign number 7. Anxiety. Anxiety is a symptom that can manifest intensely and, in some cases, serve as a warning sign of a heart problem. When a person experiences a sudden sense of panic or a strong feeling that something is wrong, it can easily be mistaken for a panic attack. However, this anxiety might actually indicate that the heart is under stress. This feeling of anxiety can arise seemingly out of nowhere, bringing with it a sense of fear or restlessness. Often, the person may feel that something terrible is about to happen without any clear reason. This sensation can be accompanied by physical symptoms such as palpitations, excessive sweating, shortness of breath, or even chest pain, making the situation even more frightening. What makes anxiety associated with heart problems particularly dangerous is that it can easily be underestimated or confused with a common anxiety disorder. This is especially relevant for those who already have a history of anxiety or panic attacks, which can make it difficult to distinguish between an anxiety episode and a possible warning sign of a heart attack. Therefore, never ignore this feeling of panic or foreboding, as it could be a sign that something serious is happening.